Here we are, part 2 of chapter 12, the fat-soluble vitamins. Continuing on with vitamin D. So, vitamin D, this is the one that is also considered a hormone. And the reason being is that it is a corticosteroid. So, like other steroids, that are hormones. And so it's kind of grouped into that category. Now, vitamin D is one that hopefully you've heard a little bit about already, so some of this stuff shouldn't be all brand new information. So, vitamin D is a corticosteroid. It is synthesized by sunlight on the skin. Specifically, the main parts are on the palms of the hands and the soles of the feet. In light-skinned people, 15-minute exposure to sun daily is sufficient to produce vitamin D. Elderly have diminished conversion ability, and if not enough is synthesized, we will need to consume vitamin D. Vitamin D has a key role in calcium and phosphate metabolism. It's also important to note clinically, most people aren't, dangerously deficient in vitamin D, but most people do have some type of minor vitamin D deficiency. A lot of that being that, we don't spend as much time outside as we used to, especially people work all day, people are in school all day. So, and also certain places we live in certain seasons tend to have a lot of overcast, they don't have as much sun. So, yeah. This says 15 minutes. Current research says more like 30 minutes to 45 if it's an overcast day, and at least 20 to 30 if it's nice out. So, just kind of clinical side of things. You don't need to know that. It's not super important for the test. Some of the sources of vitamin D: meat, fish, and milk. Milk is a big one you can look at, especially when you look at milk. They have vitamin D added in milk. So, heating it in a food process does not destroy or reduce vitamin D levels in foods. So, vitamin D is generated from provitamins, ergosterol, which is from plants, and 7-dehydrocholesterol in animals by the action of sunlight. The 7-dehydrocholesterol is present in the skin. The UV light on the skin opens up the ring to form the vitamin D cholecalciferol. So the dehydrocholesterol turns into cholecalciferol, aka vitamin D3. And then there's a step in the liver and a step in the kidney. That's going to be one of the test questions that you have. It's kind of that process of formation. So understand that with vitamin D, we get sunlight. We consume these forms. Then the sunlight converts it to cholecalciferol, and then it needs to go to the liver and also to the kidney to get turned into its final form, dihydroxyvitamin D3, also known as calcitriol. Okay? So those are the names that we want to remember: cholecalciferol, calcitriol, all that kind of stuff. And here's this whole process. So note the liver and the kidneys are involved in the calcitriol synthesis, and the production is regulated by negative feedback. Also, the parathyroid hormone. A decrease in serum calcium levels activates the synthesis, and a decrease in serum phosphate levels also stimulates the synthesis of vitamin D. Calcium and phosphate. You'll learn this more when you get into the lab portions of school. But calcium and phosphate, you'll see alkaline phosphate. Those are our bone markers. So we look at the blood and confirm that there's enough calcium. and there's enough phosphate. If there's like high levels of calcium, like too high, or too high levels of alkaline phosphate, then you know that something's going on with the bones. That's future material stuff that you need to worry about. I do apologize for the pauses. Where I'm at right now is very pollen-y, especially the past week. So my allergies have been acting up. So, okay, skin pigmentation and vitamin D synthesis. So higher amounts of skin pigmentation by melanin decreases vitamin D3 synthesis. Melanin competes with the 7-DHC in the skin for the photons from the UV light. So in that case, so somebody who is a darker complexion, a black person with dark skin pigmentation, will require about 10-fold longer exposure to stimulate sunlight to make the same amount of vitamin D in their skin compared to a white-skinned or a fair-skinned person. Functions: the major target tissues for vitamin D3 are the bone, kidneys, intestine, pancreas, gonads, pituitary, and thymus. Main ones that we get asked about are bone and kidneys. Those are the main ones that get asked about. And its job is to maintain calcium homeostasis. Remember, homeostasis we talked about, especially in physiology. That means balance. It maintains calcium balance. It regulates calcium and phosphorus absorption. The vitamin D3 increases both the intestinal absorption of calcium and calcium reabsorption from bone and the kidneys. It reduces calcium excretion by the kidneys and indirectly regulates calcium levels in the bone. The parathyroid hormone increases calcitriol synthesis, and calcitonin hormone inactivates calcitriol production by the kidneys. Just some names that you'll see. A lot of this hormone stuff will make a lot more sense when you take Phys 2. Phys 2, a lot of that course is talking about the kidneys, talking about the hormones, talking about the hormone process, all that kind of stuff. You get introduced to it here, but you'll see it all more in depth next trimester. So deficiency of vitamin D, we have hypocalcemia. You get low levels of blood calcium. Hypophosphatemia, low levels of phosphate in the blood. And defective skeletal mineralization. The deficiency, rickets is in children. You get all sorts of stuff going on, and osteomalacia in adults. Specifically, if those adults have kidney, stomach, gallbladder, or gastrointestinal problems, because then they have a difficult time absorbing the dietary fats that they need, absorbing the vitamin D, that kind of stuff. And both of these, rickets and osteomalacia, you can see on X-ray. So, like, again, in your radiology courses, you'll see those. Recent research has also described low levels of vitamin D is associated with multiple sclerosis. And if you are not aware yet, multiple sclerosis is a condition which attacks the muscular tracts of your nervous system. So it messes with the spinal cord tracts, which are connecting the brain to the musculature, and you get essentially a breakdown of the myelin there, and it affects your ability to move and do stuff. It's a very interesting condition. You'll learn a lot about multiple sclerosis. It's very heavily tested on board exams, especially part 2 and part 3.